Hello, I'm Phil from Addiction UK. Today we're going to talk about myths about addiction. Just as alcoholism and drug addiction are common, there are numerous myths and misunderstandings about addicts, addiction and withdrawal. Some of these wrong beliefs can get in the way of individuals seeking treatment. Let's look at some of these common myths about substance abuse, alcoholism and addiction. A common myth is that all addicts are antisocial criminals. By any reasonable standards, the people who crave their morning coffee are perfectly upstanding, law-abiding persons. But they are addicts, and the fact that they happen to be addicted to a legal substance changes nothing. Most of the substances to which we're addicted are legal and easily available, such as alcohol and cigarettes. It is a myth that addicts are criminals. However, they may resort to unethical or criminal means to procure their substances. Another myth is that only illegal drugs are addicting. This is untrue. Most people get hooked on the drug or chemical of their choice long before they are exposed to drugs like heroin or meth, if they ever are. Two of the most addicting substances are nicotine and alcohol, both legal. It is common to hear that problems, pressure or stress can turn somebody into an addict. In reality, there is no one who doesn't experience problems, tension or stress. If people become addicts because of them, then at least 95% of the population would be addicts, which fortunately is not the case. Addictive or addiction-prone people are born that way and are particularly susceptible to the effects of psychoactive substances. While stressful situations can often contribute, they don't cause addiction. Does being addicted mean that someone has a psychological problem? Substance dependence often gets thrown into the bracket of psychological problems because traditional medical approaches work by treating peripheral symptoms, but not always the root causes. Doctors and their patients believe that since the body has been treated without success, the trouble must be in the patient's mind. Addiction may, and indeed often does, bring psychological or emotional problems in its wake. But the primary concern is the addicted mind. Another common belief, sometimes even subscribed to by some medical professionals, is that if you are addicted to something, you will use it all the time in increasingly larger amounts. The size or frequency of dosage isn't necessarily a reliable indicator of addiction, at least not for every substance. A Valium addiction, for instance, can be maintained for many years at a constant dosage. Many people drink in a limited amount for years and then suddenly cross the line into active addiction. Often, an addict will use a substance only as often as necessary to stave off withdrawal symptoms. For example, in the case of some alcoholics, that may mean drinking in the evening after work, but only after work. Just a little something, they say, to help them unwind after a hard day. However, the truth is that the tension they have to unwind from is in fact one of the early withdrawal symptoms that begin to appear after 20 hours or so without alcohol. Now that you've learned about some of the common myths surrounding addiction, ask yourself, How many of these have you believed up until now? How did these beliefs affect the way you looked at yourself or at other people? Would you have done anything differently had you been more aware of the facts about addiction?